Hello, everyone. Today we're presenting our project, which is the predictors of HIV testing amongst Asian Americans and non-Hispanic white Americans. And this is from 2006 to 2018. I'm Mitchell Han, and my partners are Jonathan Lung and Edward He. Our fellow is Dr. Miguel Rodriguez, and our mentor is Armand Jamal.
Just to have some background information, Asian Americans live with some of the highest undiagnosed HIV rates. And this is concerning because HIV testing means earlier diagnosis, reduced medical costs, and longer life expectancy. And to better address this discrepancy, we come up with a research question of what are the predictors of HIV testing among Asians in comparison to non-Hispanic whites. In this study, we adopted the observational cross-sectional study design where we used the data from National Health Interview Survey from 2006, 2018, where we compared non-Hispanic whites with Asians. We conducted multivariate log binomial regression, as well as subset analysis on sexual orientation data.
So after conducting our multivariate log binomial regression, we have created two forest plots for the white subgroup and the Asian subgroup. And these include the prevalence ratios for each of the factors that we measured. A prevalence ratio of greater than 1 indicates a positive predictor, whereas a prevalence ratio of less than 1 indicates a negative predictor. And below that, we have our sensitivity analysis on sexual orientation, which also includes prevalence ratios for the factors such as being straight, being lesbian or gay, or being bisexual between the Asian and white subgroups. And finally, we have a table on the bottom right, which simply shows the number and percentage of HIV testing between Asians and non-Hispanic whites.
So this is important because we are looking at the strong predictors, positive predictors for both whites and Asians when it comes to HIV predictors. So some of them that we noticed that is nativity status, as well as regions and health statuses, as well as your sexual orientation does matter when it becomes white or Asians. We can actually see most of them being different in the white category, which is quite interesting for us. So what does that mean for us? Well, unfortunately, that means that there's a lot of limitation when it comes to Asian counts. There's low counts. We may have some cultural barriers as well as language barriers, as well as another limitation is the sexual orientation data being only from 2013 to 2018. So some of the next step we're going to conduct is analyzing HIV predictors for Asian subgroups, as well as conducting the annual trends of HIV testing among Asians and Asian subgroups compared to white Americans. In our QR code is going to be listing all of our references and acknowledgements, and we want to thank you for watching our presentation.